everyone, I'm Chrissy Midwife and today we're going to talk about vaginal examinations. Today we're going to talk about vaginal examinations. Why are we doing them? What are we checking for when we do them? Why do we care? Are they comfortable? What can we do to make them more comfortable? And I'm going to tell you my 3 top tips to make a vaginal examination just that little bit more comfortable for you. But before we get started, I'd love it if you could hit that subscribe button and the little bell beside it and give this video a like and a share. Okay, here we go. So towards the end of your pregnancy, perhaps at your antenatal appointments or when you're early in labor and coming into birth, your midwife or obstetrician might suggest a vaginal examination. So, what's a vaginal examination, I hear you ask? With your permission, your doctor or midwife will use 2 fingers and insert them into your vagina and reach to the very back of your vagina and look for your cervix. Well, what is a cervix, you might ask? The cervix is the narrow passage at the lower end of your uterus. It is about 2 to 3 centimeters long and is cylindrical in shape. Because I'm trying to reach the very back of your vagina to reach your cervix, sometimes this is easy to find and sometimes, unfortunately, it isn't. The reason for this is because the cervix can be in 3 positions. It can be posterior, which is at the back of your body. It can be in the middle of your body, which we refer to as central or mid position, or it can be anterior, which means it's at the front of your body. So when we do find it, it might feel like a tiny little hole, or it might be very opened and we might be able to feel your baby's head, which would be perfect if you were in labor. So when we have found it, we're going to look for 3 things. Where is your baby's head in relation to the pelvis? Is she high up in the pelvis or is she low down in the pelvis? We're going to look at the consistency or effacement of your cervix, and then the dilatation, which is those magic numbers everyone obsesses about when they're in labor. So let's take some time to talk about effacement, which is ridiculously important in labor and birth. In pregnancy, we want your cervix to be long, thick, closed, because that's going to allow your baby to stay inside of you and keep nice and safe and grow during your pregnancy. When it's coming to the end of your pregnancy and we want you to start going into labor, we want your cervix to be soft and ripe and thin and stretchy. What I mean by that is your cervix will feel firm and long. And the best way for me to describe what that feels like to you is for you to touch the tip of your nose. Go on, give it a go. That's what your cervix feels like when it's hard and long and thick and closed. In labor, when your cervix starts to soften and efface, it will then start to feel like your earlobe. Go on, give it a try. As your cervix starts to soften and become 100% effaced, it will actually become about as thin as a piece of paper, and that's when the body will start to dilate. Now, for some women, this process of effacement happens as a step-by-step process. And for other women, usually mums who've had babies before, this process will happen simultaneously. Now, in some instances, as the cervix is starting to soften and ripen, you may feel some early labor signs. You might get some period pains, you might have some sort of backaches, you might just feel a little niggly and a bit uncomfortable. And in other cases, this process will happen and you'll have no signs and symptoms whatsoever. So now that the cervix has started to efface, I'm going to assess for your dilatation. Most of you know that eventually, hopefully, the cervix will dilate to that magic number 10 centimeters to allow your baby to be born. Some hospitals have a policy that during active labor, you have a vaginal examination about every 4 hours. And the reason for this is to see how the cervix is starting to dilate. Some research indicates that mums who've never had babies before will dilate about 1 centimeter every hour. And a lot of women fixate on how far dilated they are every time they're being checked. But if you remember absolutely nothing from this video, I want you to remember this one thing. It actually doesn't matter how fast or how slow you dilate. because every woman's body is different. Every labor and birth is different. Some women may take 24 hours to labor and birth, and other women can have some contractions and 45 minutes later have their baby. At the end of the day, the most important thing to remember is that everyone and every body is different. Okay, so let's take a little look at what dilatation looks like. This is my trusty little dilatation board. As you can see, I've grabbed some snacks from around my house. I'm all about the snacks. So here's a green pea. It's about the size of 1 centimeter. And as you can see, no, definitely no baby coming out of this cervix. This is the 2 centimeter mark. I can fit 2 centimeters inside of your cervix. It's a mini Easter egg. At 3 centimeters, we're looking at the opening of my Barocca bottle. So it's a little bit bigger, but still no baby. At 4 centimeters, this is the size of the lid of my Nutella jar, which is very yummy on toast, I have to say. By 5 centimeters, which is my Jack's biscuit, which goes really well with cheese and dip, by the way, we've hit our halfway mark. At 6 centimeters, we're at the top of the Pepsi can, as you can see, and by 6 centimeters, your body should be contracting quite regularly now. You will have to stop and breathe through your contractions. You should be feeling very much in your established labor now. You might be considering some pain relief at this point if you haven't already considered some. For 7 centimeters, this is the top of my tin of corn. And 8 centimeters brings us to pineapple, which is really yummy on pizza, by the way, also. 9 centimeters is my rice cake, and as you can see, with my dilatation wheel, that a baby's head is sort of fitting into this point, and this is a point where you might be feeling that real big urge to push. But as you can see, my baby just can't quite fit there. We still have that small rim of cervix around the outside that needs to move out of the way to allow your baby to pass through. And at 10 is my big jar of drinking chocolate. 10 is our magic number. We are ready to have a baby. Now your baby is low down in the pelvis. Nothing is in her way. With a little bit of effort, you're going to be able to push her out into the world. I finally want to talk to you a little bit about where your baby is located in the pelvis. Now at the beginning of the video, I said to you, is your baby high up in the pelvis or low down in the pelvis? And that's the other little thing that we're assessing with a vaginal examination. As you can see, this baby is high up in the pelvis. She's not really engaged. And during your labor and birth, or perhaps towards the end of your pregnancy, she started to engage in the pelvis. Okay, this is not going to work if this doll isn't going to go in the pelvis. So as your pregnancy has progressed, or perhaps during your labor and birth, you will start to engage a little bit further down into the pelvis. I'm trying to find these 2 little bony prominences here, and they're called your ischial spines. And I want to find out where your baby's head is located in relation to these 2 little spines. So having a look here, your baby is engaged in the pelvis and her head in relation to those 2 little bony pieces. Now, if your baby is far away from those little bony prominences, we call her at a minus station. As your labor progresses and she comes in line with those 2 little bony prominences, we call that the 0 station. From then, your labor and birth will progress and your baby will start to become past those bony prominences, and that's when we talk about a plus station. Now at this point, your cervix is fully dilated. If your baby is low down in the pelvis, you will start to notice that your skin will start to stretch, your perineal skin. Now I do have to say, just in case you don't realize, when your cervix is dilating, the opening of your vagina is not dilating to 10 centimeters, okay? So as your baby is coming down low into the pelvis and gets to that plus station, that's when you will start to notice that the skin of your perineal skin, or the skin of your vagina, will start to slowly open. And that is how your baby is born. During a vaginal examination, us midwives are assessing the position of your baby, the effacement of your cervix, and the dilatation of your cervix. Now this all happens truthfully in about 1 to 2 minutes. So it's a lot to happen in such a very short period of time. You might ask yourself, well, why the heck do you want to do that? Why do you want to know these things? The reason we need to do those during labor, or that we prefer to do them in labor, is because we need to know how the cervix is progressing, how your baby is progressing during labor and birth, and if there's anything we need to be worried about. Maybe your baby isn't quite in the position we want it to be in, or maybe the cervix isn't dilating at all. Also, we want to know, well, hopefully if all these things are going beautifully, we actually need to be prepared for your baby to be born. So we need to maybe call in the doctor, or if you're in a midwifery model of care, making sure that the midwife is ready for the labor and birth. Now, it's really, really important for me to say to you that no vaginal examination should occur without your consent. You have to say, yes, I'm happy for this to happen. You have to allow for it. It's really important for you to understand that you are under no obligation to have a vaginal examination. You're well within your rights to say, no, thank you. I do not want a vaginal examination. With that being said, if you do consent to a vaginal examination, I have 3 tips that will really help make that process just that little bit less uncomfortable. The first is, take a couple of really slow, beautiful, deep breaths, okay? Relax your body into the bed, let your legs relax into the bed, and then lead the examination. Say to your midwife or your doctor or your nurse, please wait until I'm ready, and then when you are ready and when you are relaxed, say, okay, I'm ready, you can go ahead now. And that will just allow you to feel in control of the process and make the process that little bit less uncomfortable. So my 3 tips are: relax yourself into the bed, take 3 really deep breaths, and lead the examination by saying, okay, I am ready for you to do it now. Wow, lots to say about a process that takes 1 to 2 minutes at the most to happen. If you have any questions, drop me a comment below, and if you've loved everything I've said today, don't forget to subscribe to my YouTube channel, like this video, and give it a share. Happy birthing! No, happy birthing! I'm done, that's enough.